Gas station heroin, Zaza, and Tiana Red are nicknames for Tianeptine, a medication that is used in 24 countries except the United States for treating major depressive disorder. And in today's video, we are going to learn everything there is to know about Tianeptine, so stay tuned. Now, this video topic was actually brought to us by a channel member, and for $4.99, you can become a channel member and get your video requests and ideas bumped up to the top of the list. So let's start with, what is Tianeptine? Well, Tianeptine is an atypical antidepressant. However, it was first misclassified as a tricyclic antidepressant, but it does not have any action on serotonin. Its primary target of action is on the NMDA receptors and glutamate modulation. And if you recall the video on ketamine, NMDA receptors are the primary target for ketamine and its mechanism of action in treating depression. And so when you act on the NMDA receptors and have glutamate modulation, the effects are pretty broad. It affects the brain's response to stress, particularly in the amygdala and hippocampus. And these areas are critical for mood regulation. And so the way that Tianeptine modulates the glutamate system and acts on the NMDA receptors is primarily through targeting the mu opioid receptors. And this target is similar to opioid-like drugs. It triggers dopamine release and produces euphoria-inducing effects, which is why it has a high potential for abuse. And we're going to get more into that later on. This action on NMDA is also known to increase BDNF, which is also how and why it's used for major depressive disorder. That BDNF is brain-derived neurotrophic factor, so it helps improve our brain's neuroplasticity. And so what is Tianeptine used for? Well, as I mentioned earlier, it's used for the treatment of major depressive disorder, and it was approved in the late 1980s, first in France, and then in 24 countries across Europe, Asia, and Latin America. It is also used to treat anxiety, alcohol use disorder, and irritable bowel syndrome. And the therapeutic doses are anywhere from 25 to 50 milligrams total for the day. And typically, a starting dose would be 12.5 milligrams up to 3 times a day. And it's often used 3 times a day because it has a short half-life of only 2.5 hours. And as I mentioned earlier, it is not approved in the United States because there's not a lot of long-term safety data, especially in those with a history of substance use disorder. So is Tianeptine addicting? Yes, it is. And in fact, the doses that are used to create that euphoric feeling are larger than the doses used therapeutically to treat depression. And these doses are anywhere from 100 to 200 milligrams. However, Tianeptine is known to have rapid tolerance, and so the person has to keep increasing their dose. And so some recreational users have been reported to use doses up to 3,000 milligrams. And this high abuse potential is because of that full opioid agonist on those mu receptors. And because of that, it carries a significant risk of overdose and can also lead to significant withdrawal symptoms, including a protracted withdrawal state. And since Tianeptine is not approved in the United States, it's actually marketed differently as a supplement. So they were able to bypass the FDA and sneak it in supplements, which is how it got its name, gas station heroin, Zaza, and Tiana Red, because that's how it was being sold and is still sold in some states here in the United States. And issues of abuse here in the United States have actually risen since 2015. And in 2021, the WBRC, which is a station in Birmingham, Alabama, reported that Tianeptine was actually cited in over 1,000 Poison Control Center calls and was involved in 3 deaths. And unfortunately, those involved in that outbreak actually included teenagers that were able to buy Tianeptine at gas stations. It is also noted that Tianeptine has been used in several suicide overdose cases, and It's also noted that naloxone or Narcan can actually help reverse the effects of an overdose. So if someone has taken Tianeptine and you see them passed out or potentially overdose, Narcan can actually help to reverse that effect and potentially save their lives. Now, since the increased use and overdose deaths associated with Tianeptine, it has been banned in several states in the United States. And so it cannot be used as a supplement in these following states, and hopefully will continue to get banned in other states as this problem continues to arise. So that covers the abuse potential and why it's not being used in the United States. But what about for those who are using it as prescribed to treat major depression in these other countries? Well, it does come with side effects and some warnings. So we're going to cover that now. So the side effects of Tianeptine commonly are going to be nausea or vomiting, constipation or diarrhea, abdominal pain, drowsiness or sedation, dry mouth, dizziness, headaches, sleep disturbances, and cardiovascular effects like tachycardia and or palpitations. Now, some less common but serious side effects, aside from the abuse potential and potential for overdose, are the following: mood swings, irritability and agitation, anxiety, restlessness, elevated liver enzymes, so it's important to get your labs checked and monitored while you're on this medication, along with blood pressure changes like orthostatic hypotension or syncope, where you can faint due to blood pressure changes when you stand up too quickly. And so some drug interactions to consider with Tianeptine are the following. Alcohol should not be used because it'll increase sedation and increase your risk for overdose. And other drugs or medications like benzodiazepines and opioids should also be avoided for the same risk. This can increase respiratory depression, sedation, and overdose risk. If it is combined with an MAOI or monoamine oxidase inhibitor, or an SSRI type antidepressant, or any other antidepressants for that matter, there is a risk of serotonin syndrome. So that is something to consider if you're taking Tianeptine and your doctor wants to add a more typical antidepressant to your regimen. Be on the lookout for those symptoms of serotonin syndrome. And so what are my final thoughts on using Tianeptine? Well, we have to weigh the risk versus the benefit. And I'm a practitioner here in the United States, so I don't use Tianeptine, obviously, in my practice. However, those of you who are using it where it's legal to use for major depression and it's being prescribed for such, need to take caution, because obviously, though it has this unique mechanism of action to treat depression and shows efficacy, there is this really huge risk for tolerance, abuse, dependence, potential overdose. That has to be weighed into the picture. And perhaps if you're someone who has a propensity for substance use disorder or substance abuse, this medication may not be for you. And so even though the side effect burden may be less than the SSRIs or SNRIs, it is still not an approved treatment in the United States because of the high risk of abuse and the fact that there are thousands of people getting sick and hundreds dying from overdose of the use of Tianeptine and other drugs. And unfortunately, that is most likely a result of our opioid epidemic here in the United States. So when you're considering medications to treat your depression, including a medication like Tianeptine, I encourage you to first use your skills before going to pills to treat your depression. And when I say using your skills before pills, I'm talking about doing the work necessary to help overcome your depressive symptoms, such as getting into therapy and even looking at underlying root causes, such as nutrient deficiencies, and making sure that medical conditions are not being overlooked. I would say to do that first before getting on any psychotropic medication to treat your depression. So that wraps up my video on Tianeptine. Do you have any experience with taking this medication and want to share it with us? Drop your comment down below, because we learn from sharing each other's experiences. And as always, I thank you all for watching. I wish you well on your mental health care journey, and I'll look forward to seeing you all next week.